know what consciousness is to me is the meaning that I give to the word consciousness. So from the three minds perspective, consciousness is fundamental. It is what we call the world or what we call the universe. But the bigger question is, what is it? Right? So if one person will say, that's insane, it's consciousness. Well, we don't know what consciousness is yet. It's X. We have to solve for it. All right. Another person will say, yes, absolutely. Consciousness is everything, and that is the world. Too early. We don't know what consciousness is yet. Let's solve the equation. Let's solve the problem, and over a period of time, come to discover and discern, and either disregard it and throw it away, or improve it, or do whatever we need to do. Right. So if consciousness is fundamental, what we're saying is that.
So today I welcome Dr. Anoop Kumar to the Philosophical Gospel Podcast. He is an emergency medical physician who has produced a model of the three minds framework, which is transduced more aptly into an understanding and a practice of healing, which you'll be able to find at healthrevolution.org. That is a way by which he transmits his knowledge to a wider audience. It's an important message, and after you hear our discussion, I hope that you will visit that link to further your understanding on what the Three Minds Framework is and how it applies to healing in general. Additionally, he has started a podcast, which I am a major fan of and is how I found my route to him, and it is called the Healing is Possible podcast. This is also linked down below in the description, as well as the two books he has written, Michelangelo's Medicine and Is This a Dream? Both of which I highly recommend. I'm making my way through them simultaneously right now. And this discussion that you'll hear coming up is very wide-ranging. I very much enjoyed it, and I believe that the audience will as well. So please, please take some time to listen to it. And without further ado, here is Dr. Anoop Kumar.
Know what consciousness is to me is the meaning that I give to the word consciousness. So from the three minds perspective, consciousness is fundamental. It is what we call the world or what we call the universe. But the bigger question is, what is it? Right? So if one person will say, that's insane, it's consciousness. Well, we don't know what consciousness is yet. It's X. We have to solve for it. All right. Another person will say, yes, absolutely. Consciousness is everything, and that is the world. Too early. We don't know what consciousness is yet. Let's solve the equation. Let's solve the problem, and over a period of time, come to discover and discern, and either disregard it and throw it away, or improve it, or do whatever we need to do. Right? So if consciousness is fundamental, what we're saying is that.
And how Michelangelo plays into that.
So that started because I was in Florence with family, and we saw the statue of David, and we saw other works by Michelangelo. And, everybody says Michelangelo's a genius, right? And his work is genius, and the Sistine Chapel and all that. And I always felt like when you're depicting a human being, if it really resonates with somebody, it's resonating with something that is not just physical. That's why it's resonating so much, right? Like Mona Lisa is a classic example. Many people would not consider, if you look at the Mona Lisa, sometimes it's hard to say what it is about it that made it so popular, right? Even though that wasn't Michelangelo, but same idea. It's not just the physical aspect. There's something subtle about it. There's something deeper about it. There's something revealing about it. And the same thing with David. There's something about the story of David and even the look of determination. You can see it in his brow, right, in the statue of David. So it's not just a perfect physical figure or an appealing physical figure. It's the whole countenance that makes the human being. And so that struck me. When we talk about the human being in healthcare, we don't have that. If you look at anatomy textbooks, what you have is a human body, and there's a huge difference between a human body and a human being. And a human body is an insufficient anatomical description of a human being. So the appeal of the wholeness of being human and being in Florence is what led to that title of Michelangelo's Medicine.
It's fascinating, and like you said, it resonates at a deeper level, and it must, because people travel around the world, make pilgrimages to look at these photos, just like the Mona Lisa. Intuitively, it makes sense that there would be some deeper level that these things resonate at. However, it still seems predominantly the the viewpoint is that it's not, that it's simply a work of art that's just historically, resonating on just a visual perception and interpretive level. And so I agree with you. I mean, and obviously, especially at a deep religious level, these language that's used to describe these things is always spiritual language, because it goes outside the realm of what most language can capture as far as their impact on people.
I think
And
we have
so,
to separate the storytelling of society, the storytelling capacity of a society, from what's actually happening. And the public stories we have are generally rather superficial, right? So not the private stories, like here's a private story you and I are having, right? It's a conversation between two people. We don't have to subscribe to groupthink. We don't have to subscribe to other ideas. We can kind of creatively have a dialogue here. But when you have a public conversation, there tends to be certain things you can say, certain things you can't say, certain things you're comfortable saying, certain things you're not comfortable saying. I mean, that's why podcasts are so popular now, because you can get into all those areas that are just not conveyed through public conversation. So what's happening is what's happening. I mean, the Mona Lisa is powerful. David is powerful, right? So many of these, what we might call myths, in all the different cultures, especially indigenous cultures, are powerful, right? But they're not part of the popular storytelling because we don't have that language, especially I think our educational system, because it's rather superficial in how it approaches knowledge and understanding. And that tends to be the standardized language, right? First of all, the educational system, and secondly, English. English is kind of like the standardized language of the world. So when you combine English plus the standardized educational system, you have a relatively superficial approach and description of what is happening. And so you have the story that, yeah, it's a work of art. Yeah, it's that. But what that really means is obviously powerful. What's actually happening is obviously more powerful than that could convey.
no, that's well said. And going kind of just segueing off of that, I think that it was hard for me to see when I was in the American educational system. I had an excellent high school career, just as far as my educators were concerned. I had a lot of impactful teachers that left a lot of impact on me. But what I do notice is that there is no emphasis on the philosophical separation of mind and matter. And it's almost like, if I want to get your opinion on this now that we're on that, like if there's such a stark line between matter and mind, and it's not highlighted and it's not recognized in the educational system ever, these philosophies that are appearing on the scene today that almost make more sense than physicalism, such as idealism or mind being preceding to matter, or those things that seem kind of otherworldly, but yet do make more sense when brought to the stand and examined. Do you think that, as far as these isms are concerned, I mean, it's almost like there's not even a platform by which to question physical matter possibly being a direct result of mind or something like that? I mean, so I kind of wanted to ask your opinion on the mind, matter, and the dualism that's so prevalent. Do you see that as kind of almost an impasse to moving forward because of how strict we are when we look at the world as a material matter giving rise to mind and that kind of thing?
Yeah, I think the need for philosophy and the importance of philosophy only arises when we have radically incomplete experiences, or when we have radically incomplete attention to ranges of our experience, right? So as a baby, everyone has a certain range of experience, certain kind of experience, and we're systematically taught then to exclude certain aspects of our experience. And if we do not exclude those aspects of our experience, we will not be accepted. Like imaginary friends are okay up to a certain age, and after that, it's pathological. I'm not sure exactly where the crossover is, but it's definitely pathological.
Oh
First,
yeah.
it's cute, then it's funny, then we ignore it, and then you get medicated, right? If you keep
Yeah.
having imaginary friends. So we get taught, a baby has an experience, then they get taught, these are your eyes, this is your nose, this is your chest, these are your arms. And the baby starts to learn, oh, okay, this is me. And this is something called Ethan. This is something called Anoop. Okay, so Anoop, hand, chest, eyes. And there's no, this is intuition. There's no, this is the twinge of emotion. There's no, this is conceptualization. None of that happens, right? So
Yeah.
we're systematically taught to exclude certain parts of our experience. We're systematically taught that only if we address certain aspects of our experience will we get good grades, will people think we're smart, will people think that we're valuable. And so out of this incomplete education, incomplete is a mild word, out of this incomplete education arises the need for philosophy.
Yeah.
Right. So if that were, and spirituality and mysticism and esotericism, all of these things that we have invented as human beings, we invented spirituality, philosophy, mysticism also because of a gap in our experience, because there's something deep within us that says this isn't everything, right? What we call rationalism, what we call science, what we call all this is not everything. There's much more to this. So we have to create a space for this to make it okay. It's philosophy, it's spirituality, it's mysticism, right? So this is all the result of miseducation. Now, once you get to that point, yes, then we have to call it philosophy, which, that saddens me that we have to call it philosophy, because this is life. This is knowing the ranges of human experience. This is like, these are amazing, deep, profound experiences of living. These are the big questions that religion tries to teach, philosophy tries to inquire into, and then we create something called mind and matter and mind and body, and then we create idealism and physicalism and all these things. And it's out of this fundamental misunderstanding. Let's be clear about that, because we're not, okay, so in front of me now, beyond this camera, there's a sofa over there, right? I'm looking at it here. And now if I walk around and look at it from the other angle, I'll see something else. Maybe the back of the sofa is a different color, let's say. So I'll see a different color. We don't have a name for that in our society. That's not called sofa angulation. That's not called sofa viewership. We don't need that, because we know it so intuitively. It's such a deep part of our experiences. There's no need to formalize it into a field of study, right? Of course, there's optics, and more generally, there's perception, but nothing specific to the sofa, because we know that that's just an aspect of our experience. So I want to be clear about that it shouldn't have to come to the fact that we are now, because it sounds, when I say we must put philosophy into school curriculums, that if you tell me that as a kid, I'd be like, no, thank you. I don't want philosophy. That's so dry. That sounds, it has a certain brand, right? Philosophy. But like, do I like feeling excited? Yeah. Do I love like allowing more of myself into this worldview? Yeah, that feels awesome. That's actually what we're talking about. So yes. So now coming back to having said that, coming back to where we are and the assumptions we've taken on. Yes. When we talk about now what we call mind and what we call matter, yes, the integration of these, given the miseducation and the radicalization of experience that has happened through the educational system and through kind of societal groupthink, yes, there is a need to integrate this. And one of the impasses is actually the idea that this is philosophy, and the forgetting that this is actually us opening up ranges of experience that are native to human being, that are essential to human healing, health, and well-being.
Oh, wow. Well said. No, I think that captures a lot of what I was trying to ask with the question too, is that, yeah, it's not just simply teaching the philosophical curriculum in the schools that's going to get at the crux of this issue. It's simply a matter of looking at being completely inversely from how we look at it, seems to be at least prevalently in the West. And I guess kind of when you were talking about infantile development there at the beginning, and infants slowly being able to differentiate self and other, and when that process begins to occur, I've heard it kind of, obviously prior to self-referential, that being able to come about in a child's development. Prior to that, it's almost like the child or the baby is looking at other as self and unable to differentiate what its appendages are and what its appendages aren't. And therefore, it's obviously a learned mechanistic process culturally and in your environment that eventually attributes I to me and self to other, maybe in a mimicry type way. I've heard it kind of framed like they learn to imitate other. So they see other do a task, and then they kind of repeat that task. And eventually they're able to see I'm doing this task and that person's doing that same task. So they're able to kind of start to draw a dividing line between self and other. But what I wanted to ask you about that is, it seems like that's a critical component of this, because the overdevelopment or the over definition of the word self and the over attribution of so much to self seems to me like it leads to this really stark, almost like, and it could be cultural too. I know Vedic and Indian philosophies and stuff put more emphasis on the no self idea, on the dissolution of the self, and almost sometimes take it all the way to dissolution of free will and dissolution of anything to do with the self. How do you in this model look at the self as it pertains to medicine and as it pertains to the different types of bodies we have, like energetic bodies, physical bodies, and the development of the self within that, and then and how it works kind of for you when you look at the medicine aspect of this?
Yeah. Let me touch on one point before that, which is going back to the philosophy aspect, and then I'll touch on this, which is that I think that what we talked about philosophy is the problem that we see in philosophy now. I think philosophy has become a curriculum, has become an academic program, has become a career, and it's a particular path to healing, like everything we're doing, right? To integrating all aspects ourselves. It's a more formal conceptual path to healing and becoming whole. But sometimes that's lost. It almost becomes like it's supposed to be just this theoretical structure, and you have to know all the names of all the approaches, and that's what makes it philosophy. And to me, no, that's not what it is. In fact, some philosophers are not about that. They see the forest from the trees, right? You see what the point of philosophy actually is. It's not just about abstraction. It's not just about debates. It's about actually changing our experience and seeing our own experience of what we are in a different way. And that always, to me, has to be prime above everything else. So I'll say that regarding self and no self, the story about there is self and what it is, a story about there's no self and what it is, it's again about the same thing. It's about extending and recognizing the full range of experience. And so in the Vedic philosophies like Advaita, it asks the question of what is meant by self, which is much more important than saying self or no self, right? Because self to each identity is different. Each identity has a different range of what self feels like and is experienced like. Is self primarily the body? Is it primarily body plus some personality? Is it mostly the personality? I don't really care about the body. Is it mostly this feeling of zinging or energy? Is it feel like an absence of distinction? Is that self? All this is what is meant by the range of self and no self. And to me, what is most important is the range. It is not self or no self. It is understanding what can be encapsulated by self, what self actually refers to experientially, and how do we navigate all these ranges, and what is the world like in each of these ranges? What is this world? What does that mean about birth and death? Like all the big questions, all the so-called philosophical, spiritual, mystical, so on questions, and now what science is approaching, those questions are part of this experience and exploration of self/no self, right? So in terms of the human being, again, the question is, what is the self? In allopathy today, I'm trained in allopathy. I'm an emergency physician by training. So as an emergency physician, what I was taught is that the human self is the human body, right? You won't find that sentence in any medical textbook. Most professors won't say it because we don't realize that we're teaching philosophy. We don't realize that we're teaching physicalism. We just haven't thought about it for the most part. So when we say, hey, Ethan, we have a picture of you, and using this picture of you, using this model, we can diagnose everything we need to and treat everything as effectively as possible, right? And here's the picture, boom. And that's our anatomy textbook. Right? You have the brain, you have the heart, you have the lungs, you have the vessels, and on at different levels of detail. Organ system, organ, right? Tissue, cell, molecular, atomic, subatomic, all these elementary particles, and then down to the quantum level, waves, fields, etc. This is the biomedical model of self, right? And then there's something inconvenient called mind somewhere. We don't exactly know how it really attaches, but we draw it as a poof of clouds in our cartoons, and that kind of seems to suffice. We continue the poof of clouds idea in allopathy today at the doctorate level, right? So the model of self is radically incomplete, and there are many models in different cultures, right? In Vedanta, there's the Panchakosha model of body, mind, energy. There's the bliss body. There's different ways. Intellect. These are all layers of the human being. I use another model of the 5 bodies. Everybody has valid models. They're valid for what they cover, and they're insufficient for what they don't cover.
Oh, that makes sense. I kind of attached to this in the Bhagavad Gita, at least in some of the translations, they utilized a metaphor when Krishna is talking to Arjuna, and they talk about the chariot, and they have a charioteer, and he's holding the reins, which the reins represent the mind. They're attached to the horses, which are represented as the senses, and then the intellect is the charioteer, and then above him is the higher self, kind of observing how the mind, intellect, and senses run the chariot. And I kind of found that to be a pretty decent, at least practical example for someone who's foreign to, because I think Indian philosophy is so much, whether or not it's the right philosophy is not my really concern that I have, but it's more or less that it's so much closer to getting to this truth of mind being integral to treating the body. Like, at least it seems like Advaita Vedanta and the medicine that's practiced in that region is a lot closer to getting to this model than we are in the West. At least they have that already in the culture, and the West seems maybe a little bit further away from viewing. And in the way that I'm thinking of this and trying to bring this back to consciousness as a whole is that it seems like introducing this concept of consciousness, it's so novel to start looking at it as a problem, a hard problem, so to speak, that we're subjective and we can experience. But now that it's coming to light, my attempt is to try to evaluate it and kind of show that this is a critically unanswered question in Western science. We literally can't, we think that matter preceded mind, and therefore if we look at a box on the table, well, something about that box had to give rise to altruism and empathy and love, and something about that had to produce this. And so that's
it's a stupefying level of ignorance and concoction. Before we even considered that there is something called mind that is different from matter, we had to first invent matter. To even consider something, I have to be so disconnected from my own experience that I cannot see anything of myself in some experience. I mean, imagine it's like being in prison. One has to experience prison within oneself to say that there is something out there called matter that has nothing to do with this perceiving apparatus and this perceiving process and this identity that is being experienced, right? Just imagine the psychological condition of this identity. This has to be the psychological condition to invent something called matter and think that it exists absolutely independent of us. Now, many people hearing this, maybe not on your podcast, but a general audience would say, well, yeah, it does exist independent and outside of it. And that's just, there's a lot to say about that, but I just want to make that point clear. One has to believe within the prison of one's own identity that the sense of I, what this word I refers to, has no bearing on the experience of something else. And therefore that is matter and totally separate from me. It is a sad state of affairs. But I think especially sadder when that becomes the standard for medicine and healing. Let me give you 2 examples. One of the guys we interviewed, our podcast is called Healing is Possible, right? We interview people who have healed from all kinds of conditions that the medical textbooks say we're not supposed to. The allopathic medical textbooks particularly, right? So one guy's name was Renoy. You can watch his story on the podcast. He healed from chronic inflammatory demyelinating polyneuropathy, CIDP, which basically affects the nerves and the person becomes paralyzed, to put it short, right? The treatment in allopathy is immunosuppressants. So it's an autoimmune condition, we say. So we want to suppress the system from fighting itself and causing this demyelination. So you try that for a while, transient improvement, got worse again, ultimately had no way to go. Fascinating story, but long story short, he turned to an Ayurvedic physician named Dr. Raghavan, who said, we're going to stop your immunosuppressants and then, you'll get better. No problem. This guy's on his way to being bedridden at this point, and he's like, what have I got to lose? His wife is actually an ENT physician. He's like, should we do this? I don't know. This is crazy. They do it. They stop the immunosuppressants. Sure enough, he becomes totally paralyzed, right? And like bedridden, essentially. And now they're like, what the heck are we doing? Should we have done this? This is insane. And the Ayurvedic principle is totally different. It does not look at the physical structure independent of the mental structure. It has no bias towards body or mind. It hasn't made that insane assumption. It simply says the human constitution, whatever aspects you want to call it, whatever your model is a certain balance of forces, a certain balance of certain elements, subtle elements. You can call them mental, you can call them physical, you can call them green, you can call them blue. It doesn't really matter, but this is the theory, right?
Yeah.
And by balancing those, rebalancing those, then the human system functions appropriately. That's what he did. Over a period of a few months, he regained function, and now he's back to playing cricket full time and having his fun, right? So, and there are many different levels of Ayurveda. I want to say that it's not that anybody who is an Ayurvedic physician will be able to do this, right? Physicians have special skills, special abilities. So I don't want to make it suggest that just put your treatment and do that. I'm just showing the difference in theory, philosophy, and the outcome that can happen. One more example is Jacqueline, who had Crohn's disease, abdominal pain, bloating, fever, diarrhea, had it for decades, tried everything, was on immunosuppressants, had bowel obstructions, had surgery, removed her bowel, admitted to the hospital many times, tried everything, tried the diet, tried the meditation, tried everything, wasn't working, had a session of hypnosis, and in 90 minutes, never had a symptom again. Repeat colonoscopy was normal. How's that supposed to happen? The hypnosis has nothing to do with the body, right? So 2 examples. If you want to explain these things, you cannot go to a physicalist model. You cannot say that the body is primary and the mind is secondary, right? At the very least, you have to give them equal footing. So what we're talking about has real legs and implications for health and healing in society.
Yeah, that's very interesting anecdotes too, because those aren't the only ones, and those are a small fraction of those that are out there.
Small fraction. And even of the ones we have, what percent of people really want to be on YouTube talking about this stuff? Very, very few. And what that suggests is this is happening all over the place. These kinds of healings are happening all over the place. And we, again, because of our assumptions and miseducation, we relegate them to that's spirituality. That's mysticism. That we don't understand. We'll get there one day. That's philosophy, We just don't have the courage to say, that's our ignorance. Let's stop being afraid of that, and let's incorporate that, see what that says about our worldview and our assumptions. That's what we need to do.
Yeah, absolutely. Yeah, and that strict, tight physicalist model is a huge, major impasse into that. And it makes sense too when you think about it that when we think of almost anything, objects, matter, mind, a person, whatever, we think about it relative to its context. Whenever you think about the mind and the body, if you're experiencing mental illness or an illness of any type, it's hard to say that they almost act as if the diagnostician is viewing the body as such a closed system, like where it almost seems to me to have become, as I've had these dialogues with others and yourself, and that it's become more intuitive to me to understand that inevitably it almost has to have this relative to as above, so below is what I've heard I talked to a physician on my podcast in the past who practiced Chinese medicine and acupuncture, and his terminology of phrasing it was as above, so below. And the way that made more sense to me when I heard it framed like that was, well, we always are comparing something out here to something in there in order to even make sense of it in general. So whenever you have an internal problem and you have an imbalance of neurotransmitters in the brain, well, sure, but it's not we already know that genetics is an evolving model with like epigenetics, genes are turning on and off. It's not this. So there's something you feel almost like at some point, it's not too pseudoscientific to say that something external has to cause internal, and there has to be a relationship between mind and body, because it's not like the human organism is some closed system. So obviously its interaction mentally and perceptionally with its environment would induce imbalances in the brain that might not be due to just genetics.
Yeah, you touched on a lot of important things. One is that it's true because we are the ones who invented external and internal. Like we act as if we were born into a world that fundamentally has internality and externality. No, we experience that depending on our range of identity, right?
Yeah.
Where does a sense of Anoop begin and end, right? Where does a room begin and end? Well, we say it's where the walls are. Outside the walls is outside the room, within is within the room. Well, where are the walls? The walls are in space. If there were no space, the walls could not exist. So space is contiguous. So internal, only once we say walls, yes, walls, let's place walls on a pedestal. Now, this is internal, that's external. That's fine, that's practical and useful, but that's a choice. It's not a fact. It's not a fact of internality and externality. It's a choice based on habit and based on identity. And the difference between those is huge. That's the difference between using something beautifully and being restricted and limited by something, right? Same with the human system. What is a model of the human being? Well, it's the body. The mind is something separate. Who drew that line? Ourselves by our own limited experience. Let's go to mental illness. First of all, the whole idea that neurotransmitters and chemical imbalance is what causes mental illness is a myth. That's like a marketing kind of thing. When there's a diagnosis of depression made, when there's a diagnosis of schizophrenia, when there's a diagnosis of ADHD, nobody's measuring neurotransmitters. When there's a diagnosis of a myocardial infarction or a heart attack, we're measuring troponin levels. We're measuring electrical voltage through the electrocardiogram, right? When there's a diagnosis of a fracture, we're looking at the alignment of the bone, right? You can measure alignment of the bone if you want to, if you need to go to that level of specificity. So the whole neurotransmitter, there can be associations with fluctuations of neurotransmitters, but that is not the diagnostic criteria, right? That's just kind of this marketing thing that has spread like wildfire. Now everybody's saying that what we call mental illness is due to a change in neurotransmitters. No, it's social conditions, and it's the environment that are the dominant factors. And that's why I think when it comes to mental illness, we, like especially physicians and those trained in the biomedical model, I don't think we should be using the phrase mental illness or mental health because we don't have the training, right? Our training is in the biomedical model. Remember, going back to our model of the human being, we model the human being physically. And so when it comes to mental illness, because of our already shoddy understanding of mind, we assume, okay, mind and brain, that's the association. That's the closest association we can make, not through examination or study, but just because that's our hunch in society, that mind and brain kind of go together, and that's the predominant relationship. Once you do that, now you have to find a brain cause because then you go to neurotransmitters, and that's why that kind of happened. But details about mind, information about mind, ranges of mind, knowledge about mind, experiences about mind exist in encyclopedias around the world. That is not a part of the biomedical curriculum. And so I don't think we have the level of understanding to use phrases like mental illness and mental health in a helpful way. What we're doing is creating stigma. What we're doing is pretending that we understand the mind when we don't. And I think what we need to understand much more are the socioeconomic causes of distress, emotional distress, as well as the entire range of what is called philosophy, mysticism, esotericism, without which I don't think we can claim to be experts on mind.
No, okay, no, excellent. I think that breaks it down pretty well. And just to go back to the very beginning thing you stated, which I know is controversial, and to say that neurotransmitter imbalances are not mental illness, and I agree. I mean, fundamentally, I make like the person who's being given SSRIs, it's not like they're being analyzed to the point of their serotonin reuptake levels. Nobody's doing that scan. There's not this so, and I just subjectively, I mean, in my past of seeing psychiatrists, and nothing wrong with psychiatry whatsoever. And in fact, I've garnered benefits in certain ways and detriments in others. But what I noticed was I was given stimulants and benzodiazepines after 2 or 3 conversations. So to say that I had a serotonin imbalance, that's why I had this diagnosis, it would be fundamentally incorrect because nobody did any evaluation on my neurotransmitter levels. So sure, typically in a textbook, depression manifests as we have this inability of the synapse to reuptake the serotonin and sitting in the synaptic cleft. Well, you don't know that's happening in my brain. You assume that it is based on a dialogical, conversation and kind of observations of my mannerisms as I sit in the chair and describe my life. But never once has anybody actually analyzed the level of serotonin in my brain. And same with most diagnoses of depression and anxiety. You would have to assume that they're not doing detailed analysis on the physical part, but they're saying that it's due to physical problems.
Yeah, and it's not only that, it's that, there certainly can be associations, and there's no problem saying that there's an association, with a certain experience and neurotransmitters. We know that there are associations in experience. But once you start to say that this is a neurotransmitter problem, or this experience is a brain problem, that is just such a level of reductionism that is harmful, because then, especially if you have a white coat on, people start to believe to make that, we have to understand philosophy. We have to understand all the ranges of the mind and what else could be contributing. We have to understand the socioeconomic causes. And if we're not doing that, and if we're just saying this is a brain problem, this is a neurotransmitter problem, that's a marketing tool to market my expertise and to market my prescription, right? Yeah. That doesn't mean that it's going to be ineffective. Let's be clear here, right? Certain diagnoses and certain medications can help people, but we as physicians have to be clear about what's actually happening here. And we have to be clear that there are many other ways to approach this that may be better, that may be more long-term. And part of that could be this medication and could be this physicalist approach to things. There's nothing wrong with that. But that clarity is absolutely lacking. It happens at like the academic levels and in some conversations, but just like you said, in the popular society, the idea is that this is fundamentally a neurotransmitter problem. That is an entirely wrong approach. And it's harming people because it just keeps them on medication based on the idea that if we fix the neurotransmitter, everything's going to be fixed. And look at the state of emotional distress and difficulty in society. We know that that's not the solution.
Absolutely. Yeah, it makes sense, because obviously neurotransmitter problem could be a correlated thing, but we're so quick in the West too to look at things and call out arguments for establishing causation where there's simply correlation. And especially when people, especially staunch opponents of viewpoints such as yourself, a lot of times they would be the first ones to admonish a false correlation and stuff. And however, you're fundamentally doing the same thing when you're establishing this simple correlation that exists part of the time in some patients that have been analyzed, but they extrapolate that straight to causation almost, because neurotransmitters are the end all be all of all imbalance of mental states, as if the observer.
That's right. And sorry, go ahead.
Oh, no, I was saying as if the observer is separated from what's being observed, as if there's not this correlational, relational aspect to where when you engage with something and it engages with you, that there's not this dialogical element to your interaction with the world.
Right. And this is not just in psychiatry. So when we diagnose migraines, for example, it's similar. The diagnosis of migraine is not made based on medical science, right? The diagnosis, we're basically saying that the diagnostic criteria are this, we have a list of criteria, and if it meets that, it meets our diagnosis of migraines. But that's not based on any particular anatomy or physiology. We then can say this is associated with a certain anatomy. There's an association or correlation with certain anatomy, certain physiology. That's different. But the diagnosis is not based on that, unlike, for example, a heart attack or a fracture, when it's literally based on the anatomy and physiology that we're looking at, directly perceiving and or testing with imaging or lab results, right? Now, in the case of what we call mental illness, none of that is based in medical science. It can be associated with it. Anything can be associated with medical science. You can associate clouds in the sky with medical science, because if you do a study, you can see when people look up, there's certain changes in the blood flow, in the direction of blood flow, and that can change the mood. And of course, there's a correlation with medical science. That doesn't mean that we make a diagnosis based on looking at clouds in the sky, right? So we have to be very careful about saying that, yes, there's an association with medical science with what we call mental illness. We can find something, but is that based in medical science? Is a diagnosis based in medical science? No, it's not. And that's where the confusion is. That's what most people don't understand. And that's where we need to develop our expertise and discernment as a society to see which conditions, including beyond psychiatry, in every condition, including the ones I deal with in emergency medicine, which ones should we really be medicalizing? And which ones should we say that, there are other factors here that the biomedical perspective is not the best perspective to take. We need to reconsider those thoughts. And it's a careful conversation. It's a dangerous conversation, honestly, because we're talking about life and death. So we have to be careful with this. This is not just about leaving everything we're doing, jumping ship. This is about saying, whoa, there's a lot more going on here than we've been told, than we've understood. Let's hunker down. Let's dive into this together as a society.
Absolutely. Yeah. And I think something about that conversation being able to flourish in the West, especially in this type of allopathic medicine that you're speaking on, and the model we have, for it to flourish more successfully in the West, it can't be presented the same way it is in the East, because it's so ingrained into the Eastern medicines already that they have a lot more progress societally and culturally to get to that point. Whereas in the West, it seems to me like the dialogue starts with this scientific phenomena of consciousness. And so to get to there, and speaking with you, now that we can, in the West, it's like, okay, we can get it. Now that the West has acknowledged it's this incredibly hard problem, and to start bringing to light that science has no idea why we even can look at a color and perceive it as a qualia and have a quality of experience. Science cannot tell us that. And it seems like you can identify with more of these strict academic types and physicalist, materialist types more quickly and kind of get to the crux of what the real issue is, if you want to avoid some of the language that would normally be accepted in other cultures a little bit more readily, whereas in the West it wouldn't be. So starting with consciousness and looking at that, when I see consciousness, or when I think of subjectivity arising out of the mere rearrangement of matter over time, and then there was some selective processes that occurred, I still feel a fundamental inability for that to give way to I and me. And first of all, to give rise to desire and pleasure and altruism and empathy and all of these things that are hard to define with words. But there's no way to me that the model that we have now simply did that. And so talking on consciousness, how do you look at consciousness versus awareness? What do you think potentially the benefits are on trying to go attack this from the angle of look at human consciousness in levels and how that relates to potential evolution of medicine?
Yeah, so let me touch on one thing first, which is you mentioned science. Science is very effective at starting from a set of assumptions and giving us a method of finding out what is more true, giving us a method of finding out what is immediately false and therefore what is more true, right? So science is observing, hypothesizing, and experimenting, and that's it. And inferring, drawing conclusions from that. And then it's a cycle: observing, hypothesizing, experimenting, observing, and that is the strength of science, is that cycle, that continuous cycle of refinement, and the ability to then share that, communicate that with others, right? That's not, communicating with others is not really science. That's just hopefully what intelligent people will do. We'll have our findings, we share it with others, they give their ideas, we get feedback. But the process of science is really observing, hypothesizing, experimenting, and cycling through that. And the obvious point in that should be their observations, hypotheses, experiments are only as good as what we know to do. I mean, it's so obvious a statement, we shouldn't even have to say it, but let's say it, right? I can only observe to the degree of sensitivity that I have, right? So a camera has a certain resolution on it. It can only see what it can see based on that resolution. I can only think to the level of clarity that I have. I can only experiment to the level of resources that we have, right? Yep. So we have to be careful of the branding of science versus the reality of science. The reality of science, or what science is capable of, is fantastic. And we have to know science is a human endeavor and is limited by human observation, human thought, human resources, and so on and so forth. And we're all the same when it comes to that in my boat. We all have our biases, we all have our perspectives, we're all trying to share what we see is important to share, and we're all cherry picking in that sense, right? So let's just be clear about that. And then the process of science acknowledges this and say, look, let's minimize this bias because that's really important to get our results to be as true as possible, as relevant as possible. Now, what I'm saying is that to begin with, the very process of observation that science begins with depends on the sense of identity. And this bridges with what you were saying. And the model to consider here, the three minds framework, says fundamentally that what we call consciousness is something like algebra is X in algebra. All right. You solve for X. You don't know what X is, right? When we say 2X equals 6, right? For a simple question, simple equation, we know it. But if it were a more complex equation, 2X equals 6, we wouldn't know that X equals 3. We would say 2X equals, okay, 2X divided by 2 equals 6 divided by 2. So cancel out the 2's and X equals 3. Now I see, right? So consciousness is like that. It's an English word that is essentially X. Like, we have to be clear about that. And the levels and meanings that we correlate with consciousness, right, depends on our own experience naturally, right? The level to which I kind of experience the world and know what consciousness is to me is the meaning that I give to the word consciousness. So from the three minds perspective, consciousness is fundamental. It is what we call the world, or what we call the universe. But the bigger question is, what is it, right? So if one person will say, that's insane, it's consciousness. Well, we don't know what consciousness is yet. It's X. We have to solve for it. All right. Another person will say, yes, absolutely. Consciousness is everything, and that is the world. Too early. We don't know what consciousness is yet. Let's solve the equation. Let's solve the problem, and over a period of time, come to discover and discern, and either disregard it and throw it away, or improve it, or do whatever we need to do. Right. So if consciousness is fundamental, what we're saying is that it appears and differentiates at different levels, depending on the sense of identity. And in the three minds framework, what's called the first mind configuration of the individual, of the universe, of everything, is essentially the experience that the world is made up of distinct things, and that I also am a distinct thing, a distinct person, a distinct identity, a distinct entity, a distinct being, something like this, right? Distinctness and boundary is the characteristic, the sine qua non of the first mind. All right. Furthermore, it goes on to say, going back to the question of solving for X, which is really the critical aspect, it goes on to say that the reason the universe appears this way is because I take myself to be distinct and localized and a thing and an entity. And as I take myself to be this, and to the extent and degree that I take myself to be this, it is to that extent that the world of multiplicity and the world of distinctness is appreciated and interpreted. So the world of multiplicity and distinctness is an interpretation. It is a kind of experience. It is not a fundamental fact, except if this perspective is taken as the only perspective, then it becomes a fact. But if we don't take this as the only perspective, it becomes a way of experiencing ourselves and the world and that relationship. This is the first mind perspective. The second mind perspective simply says that as identity, let's say, integrates, or as identity delocalizes, or as identity reassociates or completes itself, then what is recognized is that the world itself of distinctness, of multiplicity, are simply differentiated waves of a more fundamental consciousness. And I use the word consciousness loosely here. It is not that my consciousness or your consciousness. It is not consciousness of something. It is simply knowledge in its native form, prior to knowledge with boundaries, prior to knowledge of any particular thing. All right. So this is the second mind range of the universe, the second mind range of experience. And this is what all the wisdom traditions try to point to. This is what many of the philosophies are reconciling toward, right? Moving from physicalism to panpsychism to idealism and so on, this kind of integrative view of things. And from the second mind perspective, it's what we call distinct objects experience are like, waves in the ocean. They're like breezes in the air. They're like thoughts in awareness. All of these metaphors can be used to give the idea. And then the third mind perspective is prior to any kind of differentiation. It's prior to any kind of appreciation of something. So these are three, let's say, configurations of mind. These are three ways of experiencing the universe. These are three levels or configurations of the universe, and all are equally true depending on the kind of identity that accesses this potentiality.
Wow. Yeah, there's a lot there, and I think it touches on a lot of, like you said, philosophical ideas that are already out there. And what I attached to a little bit in what you said is, I guess it's that idea of it's how it seems to be something about consciousness. It's there's a gentleman or professor who uses the term relevance realization a lot. And relevance realization is a study in neuroscience and stuff where what we find relevant within the landscape of our environment is differentiated so dramatically between individuals that if you and I are sitting in a room and there's stimuli all over, there's an abundance of things we could put attentive consciousness on. There, I mean, there's an infinite amount, really. I mean, I could be looking at this refrigerator or this chair, but for some reason, I'm looking at the oars or the boat. And that may sound too elementary, but it's actually fundamentally interesting to think about that as it relates to levels of consciousness, in my opinion. And so it's like, what is it that makes us driven to find certain elements of our environment more relevant than others? And ultimately, the answer to that question is what drives forth our curiosity, and our creativity is expounded almost like we're pursuing something of interest that we really don't know fundamentally why we are that interested or relevant in that area of interest. And like you said, I guess kind of looking at the three minds model is how you integrate other and self. It seems like something about if the ego and the false self, which is fundamentally in psychology a pretty well recognized idea, at least I'm not breaking it down to there's all these Jungian perspectives and Freudian, but at least there's this idea that the ego is a pretty well understood thing. It's a personality thing that's attributed to autobiographical memory, and you could tell in certain people they're overtly attached to autobiographical memory because all they talk about is I and themselves. And then there's others who seem to be at a higher level of consciousness who refer to other as almost same as self. All of the ancient gurus and yogis and things like that, they always use terms like the seer is no different than what is seen. And you see this as you do see these higher level wisdom traditions, they all coalesce back at the oneness experience being the transcendent true nature of reality. And that they usually call that awareness. And it makes it seem like awareness, consciousness, there's a separation between those two a little bit, those two ideas. But essentially, what I'm trying to get at, I guess, is it's hard to explain this without somebody having a subjective experience in feeling transcendence, almost feeling the dissolution of the ego as it pertains to subjectivity in the moment. And so I guess what I'm asking you is, how do you see this experience of transcendence, and how do you see it as it relates to helping, like meditation, psychedelics, sensory deprivation, fasting, just those things that people do that put them in a state of oneness? And how do you see that state of oneness being integrated into healing?
All right. You touched on many things. I'll see what I can remember.
Yeah, sorry.
Regarding the gurus and what the traditions say and everything, they often speak about a unitive type of experience or a second mind range of experience because of where the society is, right? The time perspective for such traditions goes far beyond millennia. We have to think, like, in our society, we think about hours, minutes, like, we're watching the time all the time. So it's 11:54, it's 11:55, it's 11:56. Like the range of time that is focused on is relatively narrow. You don't see generally a nation with a century plan, right? But presidential elections in the US every 4 years, you can go this and then you lurch that way, and then who knows what's going to happen every 4 years. I haven't seen a country with a millennia plan. I don't know, with a 1,000-year plan. And some people might say, well, everything changes so quickly, but I think the focus of time, the range of time that we focus on is telling, just like everything is telling, right? It's representative of how we see things happening and what we consider. And these wisdom traditions had much longer spans of vision. And so the books, what are considered the ancient books and the philosophical books and the helpful books, they're written for a period. They're not like the only truth, right? And that's something that we just don't appreciate because we're like, it's thousands of years old, so therefore, wow, that's it's well, that's because we're thinking about seconds and minutes. So thousands of years sounds like the Earth is how many billions of years old, right?
Yeah.
So and then how about the solar system? And so I'm just saying that with different timescales, different philosophies, traditions, different narratives, different stories are needed. So the focus on the unitive experience is because we are where we are for the last several thousand years or whatever it's been. Now it changes from culture to culture and everything, but that's why there is this focus there, right? So, and that understanding is generally lacking. So it's not all about unity, right? But when there's a lack of recognition of that, and a lack of recognition of the deeper experiences that have such dramatic influences on our day-to-day, moment-to-moment experience, then that has to be the story. So I want to be clear about that. Because of that, I also don't see this as a higher state of consciousness. I don't see the second mind as a higher state of consciousness, and the third mind, well, that's really the supreme state of consciousness. And the first mind, that's not even consciousness. I don't believe in that, right? I think it's much more useful to say these are the ranges of experience. These are the ranges of the universe, right? Take it as a hypothesis. It's not a belief. It doesn't have to have all these inherent value-laden tendencies. I think they are value-laden, but that's something that has been a discovery. It doesn't have to be taken that way, but experiment and see that as this identity is explored and as it opens up, as the boundary of identity becomes translucent and becomes transparent, what is the experience of what the world is? And what does that mean about subjective and objective? Does it mean that, well, that's just a subjective experience after all? Or does it ask us to redefine what we understand as subjectivity and objectivity, right? So I want to point that out.
Yeah.
Now, in relation to, you mentioned psychedelics, right? Psychedelics, what I've read about psychedelics is essentially that it delivers similar kinds of experiences that change the boundary of identity. That's one kind of experience that it delivers. I've never tried a psychedelic. From seeing some patients on psychedelics or hearing from people, pretty much feel like the psychedelic experience is the experience of living if one can look beyond the walls of individuated identity, right? To see the world as a hallucination, which is essentially what neuroscience is arriving at now. Neuroscience might say it's a co-construction or something, we're kind of hedging, we're kind of getting there a little bit, just like we kind of are going towards panpsychism and then towards idealism, and similar kind of thing in neuroscience. It's a co-construction, right? What we perceive as a co-construction. Of course, we don't ask what about the brain. The brain too is a perception. What is that? If that's a co-construction too, then what does that say about mind and neuroscience, right? So there are more questions to ask here. But as we begin to see the world as, let's say, representation, let's say as imagery, let's say as a knot of perceptual and cognitive flow, right? As we begin to, rather than saying hallucination, because that might be a scary word, right? So as we begin to see the world as this, what does that actually suggest about subjectivity, about objectivity, about what the universe is? I think this is part of what psychedelics offer, is this insight that into redefining our fundamental, not just the experience. Person can have the experience, and same thing happens in mysticism and spirituality. The experience can happen. What is called transcendence, views into the second mind perspective, can happen. That in itself, and that happens to everyone, by the way. Everybody has had ranges of that experience, but we're not given the stories to talk about it. We're not given the safety to talk about it, because you'll be weird or you'll be medicated or you'll be strange or something like that. And so those narratives are pushed aside, right? Or you have to talk it in terms of God, or you have to mention Jesus, or you have to mention Krishna, or you have to mention, if you don't mention those, then you're going to be going to hell or wherever the bad place is, So when you have this kind of situation, then what happens is these narratives don't come out into the public. And then we think psychedelics are the only way to do this, right? It's a medicine. It's something you ingest. It's low-hanging fruit. That's fine. I don't have a problem with that, as long as it's done with people who are experienced, people who have enough experience to know about all the different ranges and the context and the entire, let's say, the dynamics of that. That's fine, as long as that support is there, no problem. But what this is doing is fundamentally redefining these terms and redefining the nature of boundary, what a boundary is, and what can happen as boundaries shift.
Well said. Yep. And I think, like you had said, there's something intriguing about that component of psychedelic use is similar to what is experienced in deep transcendental meditations and what is in Buddhism and in Hinduism, meditations that are non-dual, as they say, or Advaita Vedanta is a non-dual perspective on being, consciousness being the supreme base awareness level of the Brahman, or like you said, it's hard to speak on these things without bringing in these terms, and that's why it keeps a lot of it out of the light. I think that's a good point. I never really thought about it like that too much, but what is intriguing is it does break down the barrier between mind one and mind two, as you describe, and then you start to see that oneness, and inevitably, as a byproduct of that, people view the world significantly differently after that, and some even hold those experiences in high regard for the rest of their lives and formulate a new moral landscape around those experiences. And that's an interesting subject, just to say the least. And meditation and things like that, and spirituality and mysticism produce similar experiences that may, but like you said, what ultimately it is integrate into our own understanding of the mind in a way that's practically useful to healing and to making us better in the world. Because the more we know about that experience doesn't make it more palatable, doesn't make it more constructive, because like you said, if it's not coupled correctly, like it's been a shamanic practice for thousands of years to induce these psychedelic states, but they had a practice by which they induced them very specifically. And it was done in an integrative environment, and the medicine was different and the landscape was different. So to go and propagate these same medicinal customs without the surrounding environment context of the shamanic perspective could lead to disintegration or dissociation, or what I've even experienced myself when I was getting ketamine infusions was a depersonalization that was really good overall, but there was no psychotherapy coupled with that disintegration. Yeah. I was given the ketamine infusions, and this was an attempt to get off of benzodiazepines in my experience. And I was able to get off of those when it was just a really personal thing I wanted to do. I didn't want to be dependent on these anymore. And that was kind of how it went. And I was getting ketamine infusions, and I would be less, or, there was no follow-up therapy associated with that experience. So then I was left with amazing insights and a real good feeling of well-being, but no way to figure out where all this comes together to integrate. So I think there's a dangerous component to potentially, and especially my experience, if I wouldn't have spent a year trying to solve the problem of consciousness, then this whole ketamine experience would have been so dissociating. And what I ultimately wanted to get back to with that is, I don't know how much of a gentleman, Bernardo Kastrov, that you've heard, or if you've ever heard of him, or if you've seen some of his philosophy, but he has a very interesting perspective that he's entitled Analytic Idealism, and he refers to our sense of touch and feel and sight as instrument clusters in a cockpit of an airplane, and that evolution actually has kind of evolved the human structure to become less aware, or to perceive the world as a hallucination, which is almost more beneficial to us to not perceive the world as it truly is. But I find we're talking about all these isms, and like you said, they're co-evolutionary in neuroscience. You're going to go from panpsychism to idealism as you progress away from materialism. But you have the interesting character in Bernardo Kastrov, who has really put forth, it's like a 150-page thesis on analytic idealism and bringing in panpsychism with idealism, but saving the science too. So I find some of his philosophical characteristics of the instrument cluster and how evolution has really just created mentation, and there is no physical, and mind at the base level. So it almost seems like a modern day scientific attempt to bridge the gap between esoteric views of consciousness as the fundamental blanket of reality and also saving the science portion of it. And I wanted to ask you kind of about that, if you had heard of that Kastrov before, and what you think on his ideas.
Yeah. As has become my pattern now, let me touch on something previous, and then I'll come to this. and the previous thing was about the shamanism, etc. Um, every practice is, in a sense, this may be going a little too far, but I'm going to say it, is that every practice, we should consider it as a powerful, powerful practice, bordering on dangerous in a good way. I think we have to understand that if we agree that our society has some fundamental things um, that are, if not wrong, radically incomplete and dangerously incomplete regarding our models of the human being, regarding our models of diagnosis, treatment, healing, regarding our system of finance, regarding our system of living, the way we work, the way we live, the way we eat. If you think that it is incomplete, and if you think there need to be some fundamental changes, we are talking about deep changes. Otherwise, they would have happened already, right? It's not, why are these changes not happening? Because they are rooted deeply within us. So, and anything powerful can go both ways. Driving a car is powerful. Driving it at 60 miles an hour is powerful. It can go terribly wrong. It can go terribly wrong. The loss of human life can happen. And it can be amazing. It helps people every day do amazing things, experiences they could not have otherwise. That is meditation. That is shamanism. That is psychedelics. And we have to understand that. Please don't think that meditation and spirituality is good and safe and nice, and shamanism is a little weird and dangerous, and psychedelics are something else. No, they're all the same. If they're doing what they're supposed to do, they're the same, because they're getting at deep mechanisms in the human system that alter belief, thinking, perception, identity. And these are the things that qualify a person for either so-called mental health or so-called mental illness, so-called fit for society, so-called unfit for society. So let's have no misunderstandings about this. If meditation is done in a way that is effective over the years, it is powerful and life-changing. It's not just something nice that I feel calm. That's the side effect. That's like a nice side effect, right? Same thing for all of these things. So now, an argument against saying it's dangerous is that when this is done with experienced people in a particular culture with certain socioeconomic understandings, it becomes less dangerous, because it's not like, well, that was a nice experience. Guess what? It's Monday. Go back to work. All right. Well, that was a nice experience. Well, go back and now you can have your steak and eggs, and it doesn't matter what you eat. Like, the experiences are all the same. No, there's deep knowledge about how this is to be assimilated, about the implications of this, about an understanding based on the miseducation that has been received, how to uneducate this person, so to speak, how to walk them back from these assumptions. And this whole integrative process is a science. It's a practice. It's an evolution that is to be done with experienced people, and so on. And that's another story, but I want to make that clear, that is such an important part of this. Doesn't matter what approach you're taking, when the pedal hits the metal, when the road meets the rubber, so to speak, when things get real, everything matters. Everything matters. And let's keep that in mind, and let's give the due respect and the due space, so that these things can happen. So that's one thing. Bernardo Kastrup, yes, I am familiar with him. We've communicated a few times. From what I've read of his work, I pretty much agree with everything he says. He's got a fantastic perspective. There was one thing I wanted to clarify that you said about, sure. Oh yes, we don't see, and I don't know if he says this, that we see like a dashboard and we don't see what's actually here. I agree with that too. I'll just comment further on that, and I think he would agree with me. I'd have to hear what he said. I think he would agree with me in saying this, which is that it's not so much that we don't see what's really here. We just see such an incomplete fraction of what is here that we don't recognize that it's a modified aspect of what is here, right? So it's not that the dashboard isn't real, in my view. It's that the dashboard is a modified aspect of what is real, and it's very useful, and I would say it's real. I don't think we need the word illusion in our language. I don't think we need the word delusion in our language. I don't think we need the word hallucination in our language. I don't think we need the word real in our language. I don't think we need the word reality in our language. I think we need to talk about what's useful, what's relevant and what helps me. Does this perception help me in terms of where I'm going? Does this help us as a society in terms of where we're going? Is it important or is it less important? If you can answer these questions and give maximum freedom with minimal restrictions, you're going to have a much more creative and well-functioning society rather than trying to box people into narrow channels, right? Or you're allowed to have this perception until age 5, and then after that, we're going to medicate you, right? I mean, it's just absolutely silly. It's such an obvious lack of understanding and fear on the part of adults in our society that we have these kinds of rules. So this is where I think that I would modify it, and my belief is that Bernardo would agree with this. I'd have to hear from him to know for sure.
Yeah, no, absolutely. I think probably most certainly he uses that analogy a lot because, first of all, it's hard. It's a lot easier to think in analogies when you're getting into philosophical ideas such as that kind of magnitude. So analogies become they're deficient in some ways, but they capture 80%. So I'm sure he would have a good good mutualisticness with what you just said. I just found it kind of an interesting take that he has, and to further that take I had watched the episode of your podcast where you were speaking with a lady who had been afflicted with potentially upwards of 20 mental illnesses, one of them being dissociative identity disorder. And Bernardo uses quite eloquently the idea of dissociative identity disorder to propagate his philosophy, as talking about the individual and each mind as being like, at some point, this ultimate mind fractured into alters, and so he draws a unique, in some of his really long dialogues that he has, which he has a lot of those, he gets to this element of that part of his philosophy, and he talks about DID, and he talks about how the dream state relates back to that, how there's all these, how alters and DID somehow are drawn back in relation to his philosophical viewpoint on the fracturization of mind into multiple agents that operate here on Earth or within the environment. But that aside, I wanted to ask you about
the first mind. Sorry, I think there's a delay between, but the first mind condition is the dissociated state, right? So I think in most of psychology, most of it, and in psychiatry, what is dissociation is seen as dissociating from a particular aspect of identity, from a particular range of experience, and creating a so-called made-up world, or escaping the current world for that. I think the integrated individual that is considered healthy is a dissociated state. As the integrated individual, as we see it in the society, because it is a first mind society for the most part at the level of scientific conversation and academia and education, at this level, that is a dissociated state. And the associated state, and what we actually call dissociation in this context, are actually bridges to association. And we don't recognize that. The reason that people can dissociate, right? Now, we have to be careful about language. What I'm talking about is the standard view in society, what's typically called dissociation in society. The reason people can dissociate like that is because there are other ranges of identity. Like, this is evidence that there are other, and it's not just a particular kind of identity or seeing the body from somewhere else or having some experience, vastly different ranges of identity, far beyond what is typically considered dissociation. And that, if not understood, would be considered pathological. Right. So that, to me, the second mind is the associative state. All right. And the first mind is the dissociative state. And so the more a person associates, the more the field of vision opens up. Right. The more the field of perception and experience goes beyond what is considered physicality. The word physical loses all meaning. The word mental loses all meaning. We're simply in a flow of experience, and all other different kinds of experiences will come up because that boundary is no longer there of what is allowed in this view is no longer there, right? Why are we not actively dreaming right now concurrently while having this waking conversation? Because the attention of the mind is in this. If the attention of the mind were woken up, there could be a concurrent dream happening with this waking experience. It's just, where's the spotlight of awareness? How broad is the spotlight of awareness, right? Where is its GPS coordinate in the mental frame? What is the breadth of the mental frame? Where does it begin? Where does it end? Right? So the individual integrated state, per the standard view in society, is, from the three minds perspective, is the dissociated state.
Yeah, that is a very intriguing statement. It's profound to think of it as the natural state of the mind to be dissociated, because that, like I said, language doesn't do us many favors in these kind of dialogues, because then you end up with misinterpretations of dissociation, misinterpretation of consciousness. But what I understand, I get what you're saying is, if we go back to what we were talking about before, dissociation would be the idea. It's commonly understood. People just don't call it that. Like when you learn academic psychology in college, you're going to learn about the Freudian view of the superego, the id, the ego, and then in Carl Jung, you're going to learn about this idea of the collective unconscious. All of these are dissociated aspects. But then we talk about dissociative identity disorder. Like there's a disorder of identity when it's dissociated. Yet we frame entire intellectual psychology really around a dissociated platform, and it kind of confuses me individually, really, when I look into these things, because without somebody like what you just said helps a lot to think of the natural state as dissociated, because then you can justify how could psychology be teaching dissociated mind, but then be saying dissociation is a disorder? And then how do we figure out what the oneness state is? Well, I think what we're getting at least with your model of the M2, M3, and I've seen your diagram, which helps. I'll kind of that's on your Twitter post, it really helped explain the relationship M1, M2, M3, but you've kind of done a good job of illustrating that here. And I think that it could be an excellent way to further this philosophy, is describing it like this, because in the West, we're just too far away from the Eastern view. But like what you're saying, yes, the dissociated state is, we have an internal dialogue. We do speak to ourselves, and that is a conscious something or another in your internal dialogue, where you understand that you should be doing this to make your future better, but instead you're doing this anyways, knowing that it's not the right thing to do. But there's a struggle between, they call it the id, the ego, the superego, the unconscious, whatever, but that's a dissociated mind. Unassociated mind, if I'm kind of understanding it, would be that oneness experience where you start to see M2 with less of a divide between M1.
Right,
and
exactly.
So that's an interesting perspective, and Bernardo uses that a lot too, just to kind of describe the alter and the dissociation. So I think it's quite neat to put consciousness at M3 and leave it unknown like a variable, and then focus on M1, M2, and that integrated relationship. And that's an intriguing way of looking at it. And I think scientifically, it has a lot of potential to help advance medicine without having to default to too much esotericism, really.
Yeah, and that consciousness is M3, M2, M1. It's just that what we define as consciousness, experiences consciousness, changes at M1, at M2, at M3. With regard to dissociation and association and DID, dissociative identity disorder, we can still talk about disorders. We can still say that there is a disorder, but we have to be knowledgeable first. That's the critical error. We can diagnose a disease. I don't have a problem with it. We can diagnose illness. We can diagnose dissociation or disorder and all that. But let's be educated. If we're going to talk about mental illness, at the very least, let's educate ourselves. I tell people, if I diagnose a kidney disease, I say, hey, I tell a person, it looks like there's a kidney disease here, and let's say it's infected, and we need to treat that. And here's what we're going to do. And they say, oh, okay, I get it, doc. Can you tell me where this kidney is? And I say, no, I actually have no idea where the kidney is. Well, that should really call into question my diagnosis of a kidney disease if I say that. If I tell somebody you have a mental illness and they say, well, can you tell me where the mind is? Brain? I don't know. We don't really know. That should really call into question my diagnosis of mental. It really should. It really should. Because if I'm a biomedical expert and I'm making a diagnosis based on something, an apparent organ called the mind, I should know where it is, because that's my expertise is physicality. If they say, okay, you don't know where the kidney is, or what is it? What is the kidney? I don't know. They should probably leave my ER, at that point. If I can't tell you where the kidney is or what the kidney is, and with mental illness, you say, what is the mind? I don't know, but this is depression. The mind is, the mind is many things. The mind is, it's this poof of cloud. You've seen it as a kid in your cartoons. The mind is how you feel, but it's not in your textbook. What is the mind? Where's the consensus? Where's the exploration? If that's not there, that's what I mean. Where is the authority to talk about that, right? I don't think it's there. Similarly, with disorder or any illness, dissociation, association, if we ourselves do not know what are the ranges of dissociation and association, where is the authority? Where is the expertise to diagnose these things in a most useful way? When everybody is ignorant, then it kind of doesn't matter, because it's like, oh, well, I see some improvement, or I'm behaving like people want me to behave. It's kind of better. And that's kind of what happens, and I even feel better because people are accepting me in this way, and it tends to be better, so-called. But if you're not taking into the full range, how much are you really helping a person? How much is their road, their path to healing really unfolding? These bigger questions have to be a part of it. So I just wanted to make clear that the problem is not in diagnosing a disorder. The problem is in the fund of knowledge that informs a diagnosis.
No, yeah, no, I understand what you're saying. Yeah, there's kind of the idea that wisdom, or at least study with knowledge, or wisdom without study can be dangerous, or something along those lines. That you have to have a coupling of literary and scientific knowledge, and as you attain wisdom, you want to hopefully that person's well studied too, so that the wisdom and the study can come together. And inevitably, when that occurs, you have a better, more holistic realm by which to practice medicinal medicine and also to diagnose. But inevitably, you have to leave some of it up to the cloud of unknown, because inevitably we don't know. And so acknowledging that unknowing, which is kind of a Zen Buddhist type framing, but acknowledging an unknowing if some element seems to induce a state of humbleness within even scientists and even psychologists, that we may not know it all, but yet that acknowledgement simply of that is a gateway to knowing more, because somehow, and I don't know how that's explained scientifically, but there is something about dissolving more of the ego and what people say they have in those situations. When the ego does get broken down and you can dissolve between M1 and M2, moving forward in your life, a lot of people are able to more integrate a humble sense of being, because they understand that, okay, this framework and this shell of I is just an attribution of experiences to an autobiography that I've allowed to become my pinnacle of actualization. But then when you get to the pinnacle and you've got the money, the cars, the fame, the friendships, the camaraderie, all of that, actualization doesn't just happen. It doesn't just, you're not happy, you're not actualized. And that's what I look at Maslow's pyramid. That's what I was educated on in psychology, as far as a behavioral analysis of how we frame our sense of being. And to me, it seems like a fundamental restructuring of that pyramid foundationally upwards is what we are doing individually when we seek truth. And when we seek truth, it's like, okay, obviously we need homeostatic desire satisfied, food, water, survival, sexual, whatever. Those have to be there to some extent. But upwards of that, you can build that pyramid differently. And I think this strict fundamental framing of it as the way Maslow presented it, for some reason, that has like permeated everything in the West. And to me, it's like I achieved a lot of things. And for some reason, what happened was, once I had all those things satisfied, I realized that, I wasn't properly braced for trauma in that experience too, because I had a traumatic happening in my life that occurred that shook my foundational sense of being, to where I couldn't justify evil in the world, and I couldn't figure out how I could integrate my life moving forward after having such a terrible experience. And it seems like there's an element too to coming to these truths is presented through whether it be physical or mental trauma. And I know you're an emergency room physician and things like that. People probably have near-death experiences a lot, which are sensitive matters. But even outside of near-death physically, people have, I mean, the mind can experience what it feels during trauma of abuse or neglect. That can initiate some kind of thing, it seemed to me, to where you have to go back and rebuild your pyramid of being, because to me it was like I had satisfied all of those, but when that happened I couldn't justify the happening of it itself. So then it brought me back down to level one of the mind and building upwards. So I kind of just, I guess what I'm trying to get at with that is, do you see trauma, mental trauma, and physical trauma sometimes as being like a catalyst or a trigger for people to begin looking into association with M1, M2, and transcendent experiences?
Yeah, let me touch on ego first, and then I'll touch on this. The ego takes on different meanings or different connotations in different fields, depending on if it's spiritual, if it's philosophical, if it's psychological. I think it can mean many different things. To me, ego is the vehicle for individuated identity, right? It's the sense of individuation. It is an aspect of the first mind view. And to me, ego is a good thing because without that, the body doesn't function, in my view. Without ego, the body doesn't function. Ego is not just like something bad that makes me incredibly arrogant, right? What it is that's being referred to as me is a certain kind of personality, is a certain kind of conditioning, is a certain kind of thinking, right? A certain way of relating and storytelling is this thing that we call me. And that me, which is this individuated sense of ego, is helpful.
Yeah.
I mean, right? Otherwise,
Yes.
English wouldn't come, right?
Exactly.
Narratives wouldn't arrive. The legs would not move, right? So ego is very useful. The problem is when it's decontextualized, it's very problematic. And that's when it's almost like solipsism, right? Everything is just my view, right? That's when the ego is decontextualized. It becomes that kind of view, that it's just about this view.
Yes.
But when
Yes.
it's part of a greater picture and it's seen as one of the vehicles of expression across what are called the three minds here, then it's not only it's necessary and it's nice, and
Yeah.
it comes with its, let's say, positive and negatives or its difficulties like anything else. Like we use a scalpel in the ER. That could be really problematic if we use that the wrong way, and it can be really helpful if we use it the right way. Just like we talked about the car, just we talked about psychedelics and meditation. It's the same thing. So to me, it's not about transcending ego.
Yeah.
It's about contextualizing it, seeing the different ways that it can behave and it does behave, and kind of accepting that, and then working with that to see how we can live our life in a way that works best.
Yeah.
So that's the way I
That's an important point too, I think, because people use that harsh word ego death all the time, and it becomes in vogue, and then it dominates the dialogue, and it comes out of context. And it's important, I think, to talk about. I mean, it's just an important thing that you said there. That's like it's almost like this peak experience of ego death is chased down. People consume mass quantities of psychedelics trying to find what this experience really is, and then they get it, and they really have zero idea of how to integrate that. And they think that what they were seeking was the dissolution of self completely. And I just think, I think that as I went through this rebuilding of through meditative practices and stuff, that if I wouldn't have been careful about how I coupled it with the correct literature and the right dialogue and the really intense searching to figure out the truth, I could have been really all over the place with a lot of my own ideas. I mean, because of the disintegrative factor that I didn't incorporate prior to that.
And that is, I think, like a fair criticism of what we call spirituality, the invention of spirituality, which we have invented. And then the early criticism is that it becomes all about apparent ego death. And then we have situations where people say, yes, my ego has died, or the ego has died. And what is saying that? Who is saying that the ego has died?
Yeah.
There's access to language, and there's access to English. There's a personality existing, And so it just becomes this, it's a very incomplete and problematic and internally inconsistent experience and interpretation. So that's that. Going back to the other aspect that you said,
Yeah.
you talked about death and trauma. What we're talking about as a shift in perspective from, let's say, from a first mind range to a second mind range of perspective, is a kind of dying, right? In the sense that it is necessarily the death of certain beliefs. And it is necessarily the death of certain things that we thought were facts, right? Depending on, it's different for everyone. It doesn't have to be for everybody, but to some extent, if there is that shift, there is the death of some things. For example, the idea that this experience of me began at birth and will end at death is shattered. The idea that there was no experience of me, or what I call me or I, before the birth of this body and will not be there after the death of this body, is shattered irrevocably. The idea that what we call this physical world, Earth, is the world, and there are no other worlds, or there's no other way to see this world, is shattered. The idea that there is something called physical that is physical, and there's something called mental that is mental, is shattered. The idea, and these are all not just ideas, these are experiences, and that the experience changes, and that's why the idea shatters. Let me be clear about that. These are not conceptual shatterings. The experience that there is something called internal and there's something called external, fundamentally, factually, is shattered. The experience that what I am is fundamentally a body, not also a body, but fundamentally a body, is shattered. So what we are talking about are all the domains that are called spirituality and philosophy and religion and all of these things, right? What we're talking about, more importantly to me, is this experience of two people looking at each other over the internet with data streaming, with cameras, and this experience changes. The experience of what is happening and how it is happening changes. So my point in saying all of this is the shift in boundary that we're talking about, in shifting the first and second mind experience, is a kind of death, because in fact, those are the things that we would hold on to even if the body were to die, right? There's some things that we say, I'll hold on to these beliefs, doesn't matter what happens. These cannot be let go of in my lifetime. And I hold on and I die. And of course, I'll continue on and with the same and have to re-experience in different ways. That's a different story. But the point is that we will hold on to that more than the body is held on to, right? So in a sense, it's a deeper kind of death. It can be a scarier kind of death, in fact. And so that's what's meant by ego death and all that, I think are misnomers, or better said in other ways. Let's put it that way. So when that kind of death is encountered, when that death comes face to face with the identity, so to speak, then that is what is being replicated through trauma, right? So the reason trauma, whether it's physical trauma, which literally scares us to death, we say, right? Because the body is going to die, and the feeling is that this I is the body. It is such a strong identification that if the body dies, then I also cease to be. And that just cannot be okay. It's not okay because it's not true. And so there's a fundamental, like, a pain. There's a conflict inside that happens with that, right? Now, if there's some sense that, it comes and goes, there's something else to it. I don't have to be a philosopher. I don't have to be a mystic. I don't have to be a spiritualist, but there's something else, then that experience becomes a little bit easier. So trauma is something that fundamentally challenges our sense of safety and our sense of living. And therefore, that's why it can challenge this, and it can cause shifts in these configurations of the mind.
That's well said. I think the implications of that become spiritual inevitably. Not spiritual, but people are at that point. People long to integrate M1, M2. People who, if you come face to face with malevolence, so to speak, and say throughout your life you have not really encountered true malevolent behavior. So that could be classified, I guess, in English linguistically by the word sociopathy or psychopathy or manipulation. If you are an intelligent human being, but you're not integrated into the world enough to recognize malevolence exists, and then you have a face-to-face encounter with malevolence at a deep, deep level. There is a lack of medical explanation and literature to explain that in a physicalist way. And at that point, and just subjectively for me, was ultimately necessary to sustain my will to live, and not that dramatic, but to sustain my will to believe in humanity and to want to continue to further my own actualization progress. I had to come to understanding at that point with, wow, how do people act that way? How is it that the mind can become that, as where self is so grandiose, also Machiavellian, and also this, and it's like, wow, that is an incredibly complex and spiritually almost necessary. Spiritual language becomes necessary because you can't just, if you are predisposed to agreeableness, openness, extroversion, and have a lot less of neuroticism and things like that, and that's your personality, and you encounter someone who has high levels of some malevolent characteristics, or the dark triad of personality characteristics, that experience seems to me to be deep. And it seems to me that it triggers in a lot of people an experience that okay, I have to justify mass quantities of suffering that seemingly occurred to myself or other without reason and unfairly. But how do I attribute that to a justified benevolent existence and therefore move forward? And so I guess what I'm trying to say with that is, as a physician yourself and everything, it's to look at mental illness, you have to frame it around probably what somebody's probably been touched by malevolence, and to explain that phenomena and can encourage them to bear their suffering and to trudge forward despite all the unfair suffering that they may have experienced is a hard burden to ask somebody to shoulder. But it's almost seems to me required, because how you react to suffering, it almost seems to me like that determines how well you integrate M1, M2, as we're talking now about that scenario. So I kind of wanted to ask your thoughts on something like that before we ended the conversation, just to get your thoughts on it.
Suffering is an aspect of life. It's a part of life. This isn't, to me, it's not about escaping suffering. I think a lot of the wisdom traditions are framed around escaping suffering. This is about integrating suffering, seeing suffering as an experience that is a part of life, that has meaning. Like everything has meaning, right? Depending on how much we want to delve into these meanings and how much they enrich or make things difficult for us. Those are all different questions, but that there is meaning, that suffering is an experience that's a part of life. I think that also is an important aspect of the picture, that it's not about escaping suffering. I do think that as this gets integrated, the experience, in some ways, the experiences of suffering can be more. It's just not so much as just from an individual level, but you look at a society, and if you see what a society is going through, then we want to help more in that sense, right? So in some sense, that can happen also, depending on, again, the sense of identity and what range at which we're engaging identity and engaging the world. And to put it simply, rather than mental illness and malevolence and those things, I would say that, when we, like, hard times cause suffering, and integrating that as a part of life. And it's even malevolence, it comes from somewhere. It comes from some experience that leads to malevolence, right? And I think there are better ways to explain that than mental illness. These are kinds of distress, emotional distress, misunderstandings, ways of representation. The mind is representing things in a way that is meaningful for this person, but perhaps not appreciated by society because of the lack of the fund of knowledge or the attention being elsewhere. So in that sense, I tend to see it rather simply, not to oversimplify it, but I think sometimes getting lost in the language puts us down a kind of one track of thinking, when I think the solutions are perhaps all around us.
It's a good way of saying it. Yeah. And I think so too. I think diagnosing mental illnesses and medicating them with, all these medicines and everything like I had been on in the past I had some deep desire to get off of them. I didn't have the intellectual understanding to know why, but I knew that for some reason I didn't want to live with this chemical dependency, and that was kind of my goal, to get off of them. And I just to not go too out crazy with malevolence and all that. More so, my point is it's like the psychiatrist and the person receiving the care from the psychiatrist. The psychiatrist has to be able to understand that when people are touched by malevolence, that they can't frame. There's a framing issue, and they can't frame it into what they had conceived as you have this. I mean, as Carl kind of uses his analogy of free energy, where we try to limit our encounters with surprise, and we try to limit our encounters with things that interrupt what we assume to be the normal. So when I walk into this room, if there's a giant bear in the corner, that would be very, very off-putting. Because my inference is my generalized template for what this room should contain is a table, not a bear or something like that. And so understanding that if somebody has had a very stark encounter with what they expected to be reality and what wasn't, and there was a clash, that's not medicatable, or that's not. So it's paying. I'm kind of trying to pay homage to, not homage, but credence to your model through that explanation, by saying that, yeah, there has to be like just an understanding of mind, that when somebody has had a encounter with what they expected to be reality and it was starkly opposite, that creates a weird dissociated mind. And you have to understand mind, like you said, fundamentally, that, okay, well, you've had that experience. Well, let's give you all these medications. Well, no, you've got to understand what happened when they had that experience. How can they reintegrate the dissociated aspects that have occurred? And so ultimately, yeah, I think that using language like malevolence, that probably doesn't do too many favors, but ultimately it seems like, yeah, that mental health has to recognize that there's all of these M2, M1, M3 is a great phenomenal way of describing how almost all of this could be handled in a functionally therapeutic environment, if that makes sense.
Yeah, makes sense.
So,
and everything has a role, right? This is not to exclude any role, but to know what the role is of any particular approach, again, requires a more complete fund of knowledge.
Absolutely. Well, it's been quite nice chatting with you. I really appreciate you coming on today and talking with me, Dr. Kumar. It's been I've been a huge fan of your dialogues with Chopra, and I look forward to getting into your books, and I look forward to the future of your work as well. It's been quite neat to encounter. You have a very cool, unique perspective on combining different aspects of things, but keeping the core of it scientific, but also not disposing of the alternate. So I think that is fundamentally unique. And finding you and Bernardo at the same time, I was like, these two guys, they have fundamental similarities. And they also, I was able to kind of take some from both of you guys. Like, this is a unique thing that I think is going to have great impact from the future of your work and the work that you guys have done and yourself has done already. So thank you again for spending your time with me today. And hopefully we talk again in the future. But until then, I wish you the best, and I'll look forward to your work.
Thank you, Ethan. It's been a pleasure.
Thank you, Doctor. Have a good day.
You too.
Thank you.